Thank you, Mr. Chairman, and thank you to all of our witnesses. This hearing is about access to quality care for all Americans and having good options for getting that care. And while nonprofit hospitals can serve a critical role in providing a benefit to our local communities, I have serious concerns about the IRS guidelines that are in place that are used to identify whether a hospital meets those requirements. We've talked about that, pretty much all day, but in some cases, it looks like a patient with financial insecurity needs to fill out more paperwork to receive financial aid than it does for a hospital to obtain nonprofit status. In a Wall Street Journal article published in November of last year, they detail how a patient must use a 19-item checklist that includes 3 months' worth of bank statements that must be shown and show all deposits and withdrawals, loan information on all cars that they may own, and among other things, a list of the applicant's monthly expenditures for 17 different categories. They must do all of this while meeting a 10-day deadline set by the hospital to file their paperwork to see if they even qualify for financial aid. Meanwhile, a nonprofit hospital only needs to satisfy limited and very vague requirements set by the IRS to maintain their status. This is clearly one example of how things can go wrong. So I'm glad that we're having this hearing today, that it shows that when Congress delegates authority to an executive agency without sufficient oversight, agencies like the IRS can create more confusion and bureaucracy in our healthcare system. Dr. Bai, is the excessive amount of paperwork required to be completed by a patient in financial distress to receive access to care, is that a requirement by the IRS?
It is actually indirect requirement from IRS. So the IRS says hospitals must have an eligibility policy there. What exactly in the policy is up to the hospital to decide.
So it's not the IRS that's requiring it. The hospital gets to decide.
The details, exactly. But
so,
you have
so
to
the IRS is not requiring that they fill out a list of every single expenditure for 17 different categories.
Yes, that's correct. So if a hospital want to do good things, they can. They can make it very accessible and tell the patients face-to-face and make it like one-step process. Or if they want to do, try to increase their revenue and reduce their charity care, they can make the process very, very complicated.
Okay, so this sounds like it might possibly be a hospital that's trying to avoid financial aid through creating a very overburdensome paperwork trail for their patients.
Mm-hmm. And also increase eligibility, the floor level. Let's say 300% federal poverty line.
Is there something that Congress can do to address this?
So I think if we have a broad, bright line requirement of eligibility, then there will be variation, right? Some hospitals, wealthy neighborhood, you want them to be more general, right? But some hospitals in a poor neighborhood, you want them to be, especially facing financial threats, you want them to be more flexible. So I think this should be decided at the local level, at state or county level. Once they have the information from the federal government, they can decide based on their situation.